another somebody that just joined us?
No. My phone, the phone just dropped a little bit. Sorry.
Oh, okay, because I see we have a call-in user, too.
Really?
Yeah.
No, I just, sorry, I just changed another phone. I'm going to hang up the other one.
Oh, well, you're cheating on me. Don't confuse me now. I'm easily confused. I haven't recovered from my trip to Philadelphia yet. It was a long week.
Right.
Yeah. So do you have any questions for me while we're waiting for your therapist to get there?
Just this template, isn't it specific to OBGYN and
No, ma'am.
primary care? Oh.
No, ma'am. If I go right here, I have several specialties I could pick from.
Right. Okay, so
we would change. You don't have to start on this. This template can just be set up so that it automatically pops up. And some people like it, some people don't. I just wanted to show it to you that it's an option.
I'm sure that my therapist will not like it.
He won't like it.
I can tell you why. Yeah,
Why?
I can tell you why. Because for one of his problems is, you see this medication thing? It keeps popping up on his notes, and he doesn't want it there. Because every time he pulls a note and tries to do, chart for a patient, when he previews his note, what he sees is that after he does his stuff, it pulls up from other clinics that the client has been to the same facility. So it pulls up his medication, the client's medications, everything into his own notes as physical therapy notes. And that makes it,
Well, we'll close it, but that's just the way the physical therapy note was built, so we'll have to talk about that.
So that's from there? Oh, so keep it open so he needs to see it.
Leave it open?
Yeah, let him see it. I mean, we never went there. This is the first time it's the first time I'm seeing it.
It's got I just call it, this template is one template in your database. It's not for putting any information in. It's just a high-level overview of the patient. You can see their meds, all their visits, their orders, their blood pressure graph.
Previous note from here.
Well, no, not exactly from here. His previous note is back here on other exams.
Oh, okay.
And I noticed that, I don't know who's logged in here, but they do not have all the privileges. They're restricted from documents. They're restricted from diagnosis.
Yeah, it's probably me who was playing around with all this. So that's
well, I'm going to log out, and I'm going to try to log in as myself, as NextGen admin, and see, because I don't want to be restricted, because that's going to keep us from getting into some things that he might need.
Right, yeah.
Nothing against you or anything, just want to be able to...
Yeah, sure.
There we go. Now we got everything.
Yeah.
Okay, so I'll pull this back up just so he can see it. He doesn't. You don't have to start here. A lot of people like it because it gives them a real high level overview of the patient before they ever, even can go in the room.
Right.
Because this is a long template. Also, it gives them a lot of information.
True. Mm.
Okay, we'll go through it again when he gets in there.
Sure. My basic questions are just about what concerns me, basically, is...
You don't need the duplicate?
Huh? Well?
Sorry, I forgot to mute my phone. Okay, that's fine.
I was going to say, I don't know that he's talking to us.
Well, are you talking to us or you're doing something else?
So I'm sorry, what was your question?
Yeah, I was going to say what concerns me most is the billing part, which is where I work mostly in. I, pull up his charges. Right now, figured out a way to submit his codes, but I don't know if it was told to you, we had to apply Medicare rules for us to be able to submit charges. Without doing that, we can't, submit.
Yeah, I wasn't told anything about you except that we were doing the physical therapy, templates. That's all I was told. So.
Oh, okay. So we'll stick to that. I guess everything will just add up at the end of the lecture.
No, I would suggest maybe leave that to show us everything. Then if you have
then we'll ask the questions.
Because we never be treated systematically, That.
Yeah.
Okay. Thank you.
So have you been with the clinic a long time?
Sorry?
Have you been with the clinic a long time?
No, just a couple months, like 9 months now.
Oh, wow. Okay, so you're relatively new.
Oh, yeah, I'm relatively new.
Where are you from?
With Next Gen. I'm from Nigeria.
So how long have you been here?
About the same time, 9 months. I was here.
Wow.
Yeah. I came actually for training, so I'm pretty much just training on the job and learning the, health informatics system and stuff. That's what I'm doing here.
So do you like Brooklyn?
No. Honest truth?
Now, just tell me the truth. Tell me how you really feel.
Well, Brooklyn is this. I don't know. It's just, it's what it is. It's just there. No fun, nothing. It's rough. It's not pretty.
Very congested.
Yes.
Yeah.
Congested. Pretty much so.
I always have trouble when I go there because, to New York because it is so congested and people
everybody's
are just back home.
I have family living in Maryland and they will not come to Brooklyn. No, they will not.
You just feel like you can't breathe there.
Yeah. I mean, I'm getting used to it all, but it will never be what it is for me. It's not fun for me. It's just routine. Brooklyn seems like routine for me. Go to work, come back home, stay indoors. Go to work, come back home, stay indoors.
Yeah.
That's what I do.
Well, there's not a lot of options. I mean, unless you want to travel out of the city.
Yeah, and I don't have time to do that most often, so I just stick to being in my room. Maybe watching TV, if I can.
That gets to be old, too, though.
Yeah. So, wait, where'd you say? Down south?
Where am I from?
Yeah.
I'm actually in the Midwest. I live in Cincinnati, just east of Cincinnati. I live out in the country, outside of Cincinnati.
Must be fun.
So I kind of like it. We have, some space to breathe, and we have neighbors that have animals, and
wow, ranch style.
Well, not really ranch, but there's a farm across the street, and
and big houses and big spacious rooms, I'm sure. Brooklyn.
Yep. And we see a lot of tractors, and things like that. So
that's going to be rare in Brooklyn. They don't even have soil; they have roads.
Yeah, it's cement everywhere.
Yeah. Oh.
Of course, there are advantages to that. You don't have to worry about cutting the grass and all that kind of stuff. But
no. Well, people want to worry about that. Well, sometimes it's just fun to have nature.
Right? I have my little
more
bird.
advantages than anything. He's just trying to, I can hear him rounding up with some of his clients.
Okay, that's fine. Yeah. That's fine.
Get them out.
This is for his benefit, so we'll just wait till he gets here.
Okay. Sorry.
That's okay, unless you have any, questions for me. I'm here to help any way I can.
I know. I just want to wait until, we understand the template. Maybe if we understand the template, then it will help me understand other things and everything will work out fine. Maybe there's something we're not doing wrong. That's why I will have those questions. So if I go ahead to ask questions, then we might, you might still take care of it when you're training on the template.
Sure.
Yeah.
So did you learn medical billing after you came here or while you were in Nigeria?
No, here. When I came here. We don't use billing.
Yeah, that's what I was wondering. How
society. Yeah. Billing back home is like everybody pays cash.
That'll be $50 and you pay $50 and there's no worried about codes and stuff.
Yeah. So it's like you pay cash for service. It's fee for service.
Well, you'll find a lot of providers here that wish it were fee-for-service.
I know that. I'm telling you because insurance companies know how to chump.
Yep. So I said, this is, I've been in this business a long, long time, and I said, it's the only business in the world where you set a price for your services, you charge the price, and then the payer pays you whatever they decide they want to.
Yeah. I mean, I'm serious. It's like weird. It's like a whole new different, experience for me, because back home it's fixed. You don't debate. Patient don't. I mean, you see the service, you can afford it. You can't afford it. Sorry, you go somewhere cheaper. Or you have a payment plan that you pay with, but it's cash. Recently they introduced the insurance thing, but the insurance thing is not as big as it is here. It's just basically takes care of a certain percentage of what you bill. So like if you have drugs in Nigeria, the insurance takes care of like 90% of your drug fee, and you pay 10%. So you pay the 10% to the hospital, and the hospital goes after the National Health Insurance Scheme to get the 90% of the drug. That's how it works. Yeah.
Different here.
Yeah, very different. It's a whole new learning process. Because I'm like, wow, everything here is full insurance. You don't have it. If you don't have cash, then you have to have an insurance. If you don't have insurance, then you're done for.
Yep. No service for you.
I'm telling you, it's weird. Okay, he's here. So he's gonna take over.
Okay. Hi, David.
Hi, how are you?
I'm good. How are you?
I've been better.
Oh, come on, it's Friday.
My therapist is down.
Okay.
Okay. Let me close this and restart. I know that you have been starting on this PT home. On this template. And there's nothing wrong with starting on this template. I see you've made a few changes to it, which is good. There's nothing wrong with starting on this template, but I want to show you another one that you can start on that might be helpful. It's on the Patient Demographics tab. There's 3 tabs over here, and it's on this middle tab. And it's called the Adult Chart Summary. Now I'm going to go back to the Encounters tab, just so we'll be on the Encounters. This template is not for putting information in. It's for just a high-level overview of the patient. I'm just going to show it to you. You don't have to use it, but I'm just going to show you that this is a place you can start if you want to. It's got their allergies, their chronic problems, their meds, their visit history, any orders that they've had, their blood pressure graph. This is a long template, so I'm going to scroll down here. Has their assessment history, their vital signs, their weight graph, their telephone calls, the history of all their communication, their past medical history, their assessment history, their pulse graph, their BMI graph, and any lab results that have come back on the patient. Just for viewing. It's just a high-level overview of the patient. Now, if you start on this template, you would select your specialty here. If I click on this, I get a pick list. You would select your physical therapy, and then you click the word home. And it's going to take you to that PT home template.
Okay.
Now, I'm sorry, do you have questions? Or
what's the difference with doing it like this or the other way?
The other way, you get that high-level overview of the patient before you start seeing the patient.
Oh, okay.
It's just a place to start that has almost everything there is to know about that patient in one spot.
Okay, got it.
Okay, so that's the advantage. And then you can click home and it starts you into your physical therapy. You have required fields here. You have to say whether it's a new or established patient, and you have to say the visit type.
Right, this I know.
Okay.
I actually made a list of the couple of issues that I've been having. I don't know if the issues that I'm having is next gen, and there's no way to edit them, or we could somehow change some of the stuff.
Okay. So you're totally comfortable with the templates? Except for
for the most part, yeah.
Okay, so you want to tell me what kind of problems you're having? And
Sure. So I don't know if I can control this, but
sure, all you have to do is click the mouse one time, and you'll have it back.
okay. So let's say I pick treatment, correct? And okay, so I'm going to add an assessment so that I can do the eval. Now, the first thing, the first problem I have is that none of this stuff carries over. So wait, before I start, I'm sorry. You see where it says the vitals and the medications and the diagnostics?
Mm-hmm.
When this evaluation prints out, it prints out all of the patient's medical, surgical history, their medications, which doctor they saw in the office, etc., etc. I do not want to send all that information to the insurance companies. Is there a way to delete that off the final eval? I mean, they do not need to know which doctors that the patient saw in AFAM and all their medication lists, and that just shows. I feel like it shows the morbidity of the patient, and I get less sessions that way because they see it as that the patient is very, very sick. For example, they have this problem and that problem, and they're not going to do well in therapy. So I just feel like I get less visits that way as opposed to a patient where they don't have an idea of all the comorbidities, and I'll get more treatment sessions that way.
Okay. I'm going to take this control back for just a second.
No problem.
So let me see this note right here. Is this going to be the PT progress note? I'm just going to run it. We didn't put anything in, so it's only going to pull forward the histories that the patient has.
No problem.
So on this note, if you don't tell it... I'm sorry, go ahead.
On this note, it doesn't come up, but if you open up any of my patients,
all right,
all their past medical history.
That's what I want to show you, why that's printing.
Okay.
Okay. So if I go to, let's do an evaluation here, physical therapy evaluation. You put your you put your assessment in, you put your reason for visit, then you're going to go to your PT eval. So now your navigation changes to across the top, right?
Right.
Okay, so let's put our assessment back in here. And I'm sorry, what did you select as your assessment?
Low back. Yeah, right there.
Low back pain. Okay. All right. So I'm going to go ahead and I'm going to put in what I'm going to do is not going to make a lot of sense. It's just going to give us some stuff to put in there.
Okay.
Okay? 3 days ago. So, bending over. All right, so that's the HPI. Now, I don't need to add anything down here. You know that there is fields that you can type in if you need to. Now, when you go to the Histories tab, one of the reasons a lot of that stuff is showing up is because this says include histories in document.
Okay.
If you do not want that to be included, if you undo that little black dot, the histories will not be included in the document. Okay?
Okay.
So now let me go to the objective. And I'm just going to go lumbar. I just want to show you what it looks like if you don't do all that. Lumbar sprain. Now I'm going to go to my assessment. I know I'm skipping a lot of things, but I just want to show you what the difference is. Okay, so now, do you go to this print, this preview?
Yes.
Okay. So let me show you the difference in unchecking that one little thing makes. And then we'll discuss about then we'll discuss this. This is the evaluation. Before we printed the progress note, this is the initial evaluation because I selected initial evaluation. Okay, you want to scroll down there?
Sure. I said, okay. It says you're controlling. Okay. Okay, so now it's not here. Okay.
Keep going on down. So
Yeah.
that's the one little difference. That one little black dot on the history tab made all that difference.
Okay.
Okay?
Okay, got it.
So now I'm going to take this back. What other issues were you having? I'm going to go through the templates, but those simple things that I can just show you, just with this one little click, you can change that. So what other issues were you having?
Okay, so if you can please go back.
You can drive. You can take control of it.
Okay. So I'm going to go back to subjective.
Okay.
History of present illness. And I'm going to do what I would normally do, let's say, for back pain.
Okay. Here's. Let me tell you another little thing. Let's say there's things in here that you wanna change. If you'll right click in the background of it, right click in the background of the template.
Okay.
Nope.
Oh.
Close that. Just right click in the background of the template. Right there. Right click. Right there. Hit clear. Hit clear. No. Clear. No. Clear. Just say yes. Now you have a clean template to start.
Okay, so severity. So first of all, there's okay.
Okay, the difference there is this. And that little blue eye is an information. It kind of gives you a description. The difference is, on the severity, it can be mild, moderate, or severe. Or if you click in the field, it gives you a pick list of from 1 to 10 for severity. So
right,
it's an either-or kind of thing. I'm sorry.
Right. No. Is it possible I can change it to the numbers, because Medicare needs an objective number? So like
sure.
I'm always writing it by hand.
If you just don't click the little down arrow and you just click in the field,
right,
you're always going to get the number.
I think we make it be like out of 10, like that.
Yep. Severity out of 10. Okay, I'm going to take this just for a second. I want to see which pick list this is. Severity. Okay. You want me to change that right now? Who does your template?
You want to write all of them down, and then we'll do it.
Well, let me ask you this: who does your template editing? Anybody there on site do template editing?
I don't think so. I don't think Val does it. Val?
Yes, sir, excuse me.
Val, do you do the template editing? She wants to know. Ms. Brand wants to know if you do the template editing.
It's there. I think you can go there.
He's got some changes that he wants to make, and like this one is a very simple one, just to a pick list. And I just need to know if there's anybody there on site that has the responsibility of doing template editing.
Yeah, for now, yeah, just me, I know something, but not everything. And then the Miss Harry, just got to it.
Okay, Val, I'm going to need a few minutes with you.
Okay.
If what he needs changed is just these simple things like pick lists, I'll show you in template editing where you can go to do those.
Yes, please.
Okay. Okay, go ahead, David. I'm sorry. I just needed to get that clarified.
No problem. Okay. So I'm going to put 7 out of 10. Let's see. Low back, left calf, deep ache, aggravated by flexion, sitting, down and contact. So now, now when you write this down, this doesn't like really make a lot of sense. I was wondering if there was some way we can make this make more sense. So, for example, when
Okay.
Yeah, go ahead.
You want all that wording changed?
Just to make it make more sense, as opposed to like being statements.
Yeah, there's a way, but it's going to take a lot of template editing to do that. So you want it more in bullet points?
You know what? It's okay. It's fine. No, I want it more in a sentence form. But okay, it's fine. I'll just keep it over here.
Okay.
Okay. Now, can I go? Okay. I'm going to. Let me see. I wrote down a bunch of stuff. I'm sorry. 1 second. Okay. So in the objective, in the lumbar, for example, I'm going to. You can see my page, right? The special tests. These aren't really special tests. Dropped foot is really not a special test. So all this page is really wrong. There are really no special tests for the lumbar spine.
No. You're not reading that right. Go back and click on the word special tests.
I did. Okay.
You're saying that you don't do those tests?
Heel drop is not a special test, no. Knee weak? What's knee weak?
Well, it's just a test to see the strength of the knee.
No. I mean, Trendelenburg is not a test. It's a gait.
Okay, so they're using the term special test, but that doesn't mean it's necessarily a test. It's just an observation, right?
Right. So that's why I'm saying.
And if you look at the top there, you're looking at functionality.
Right, but what I'm saying is, first of all, the Trendelenburg and stuff should be under gait, and there are no special tests for the lumbar spine.
So if we change that text from special test to gait?
No, but what about the special tests?
But I thought you just said there weren't any special tests.
That's the problem. I want to delete this stuff and put in the tests.
Okay,
like,
so
example,
you don't want any of the. Okay.
Let me show you. I'm just going to go back for a second.
Okay.
So let's say I go to shoulder, right? Do you see on the left side here it says anterior comprehension, relocation, translation, posterior, speech test. These are all tests to determine the diagnosis. So negative, positive. For the lumbar spine, this doesn't exist. If you see over here, none of this stuff exists. See, this is range of motion.
Right.
And the bottom is a range of motion for I don't even know what. What is that a range of motion for?
Okay. Go here. Hold on. See there by hip it says range of motion right, range of motion left. Those blue words.
Right.
Click on one of those.
Okay.
That's where that's coming from.
Okay. Okay, so I see what, okay.
Does that make sense?
Yes. But is there a way to add in the special tests?
Yes. Do you have a list of them that you wanted to add in, or?
I can
and
get a list.
Have you looked at all these to make sure that they're not on here somewhere already?
As far as I know, yeah, I've been doing using it for almost a month now, I think, and There is no special test for the lumbar spine.
Okay, give me an example of a special test for the lumbar.
Repetitive lumbar flexion, extension. Only one of them is here, which is the straight leg raise.
Okay. What about this?
What about it?
That still doesn't cover what you're asking for?
No,
Your flexion, your rotation, your extension?
No. This is different than the special tests.
Okay. So have you found that under others besides the lumbar?
I think the other ones have it, only the lumbar doesn't.
Okay. So, straight leg, femoral stretch, are those ones that you document, or?
Only straight leg, femoral stretch, no, not really.
Okay, when you click on this, say you don't do the quadels or the femoral stretch. Okay, I'm just looking.
No problem.
And none of them are under the range of motion, right?
Well, the range of motion is range of motion. It's not a special test.
Okay. What you're going to need, what we're going to need from you in order to do this is a list of all those special tests, what the responses would be, what you need to pick from on those.
Okay. Okay, no problem. I can come up with that.
Okay. Is that the only one? Lumbar's the only one you've got that issue with, right?
Yes.
Okay. Okay, next. Got it on the list.
Okay. Okay, so let's say I'm going to control this. Let's say I click on knee right here. Let's say I have a patient who has bilateral knee pain. So if I cannot click right and left, it's only one. You see that?
Yep.
It won't let me click both. So that if I want to do, let's say, knee arthritis, it won't fill in the information for both ever. It only lets me do it for one for some reason.
Okay, but here's the deal. See these copies? If I examine the right over here and I find this and it's the same on the left, if I pull these over here, it copies them. Excuse me.
Yes, I know I can do that, but it's just in the sake of time. If I have to do that with everything on this page, it would take me twice as much. I was wondering if I could just click both on top, and if it's the same, it should go in right away.
Okay. Okay, got it on the list, under the knee.
It's both, the hip, the knee.
Anything that has bilateral. Okay.
Okay. Got it. So hip, knee, shoulder, any that are, which almost everything is bilateral, right?
Right, so let's say if the patient has the same thing on both sides, which a lot of them happen to do over here.
Okay.
Okay, ready? Okay, so now if I go to MMT over here, Lower extremity strength. Okay. Is there a way to do this by, like, put in a grade for the entire right side and then a grade for the entire left side?
No.
No?
Nope.
Okay. Meaning, like, let's say if I put in 4 out of 5 and everything is 4 out of 5, I don't want to click one by one 4 out of 5. I would just put in.
You could do it with template editing. We could put whatever you put in that first field, populate to all those others, but it would take some time to edit the template so that it would populate all of that. You would want every one of those copied to all of those, clear down to the foot?
Yeah, I guess so. He can edit the ones that are abnormal, or leave the ones that are normal as normal.
Well, yeah, it can be done with template editing, but it's going to require a lot of template editing on this template.
All right, if it's a big deal, then forget about it.
Extremity strength. So whatever you put in this first one, so let's say it's 3 out of 5. You want 3 out of 5 in every one of these.
Yes, that's possible. Or like 3 out of 5, let's say in the hip, knee, or ankle.
Okay. Lower extremity strength. Copy. Populate. All fields with first response. Okay, got that on the list. So you want it in all sections, not just in a hip section, a knee section, an ankle section, a foot section. You want it, whatever you put in that first hip section, to be in all of the sections?
Yeah, if possible, like maybe you can put it like a dot copy all the way down. You know what I mean?
If I say, here's the deal. If I say I'm documenting the right, let me clear this and show you how this works. If I say I'm documenting bilaterally, it puts in 5 out of 5 in everything. Then I just change the ones that are not. If I say...
Right, but no one is ever 5 out of 5. 5 out of 5 is perfect.
Well, it starts with perfect, and then you go up or down from there.
Right, so I don't normally click that. I just put in one by one because everyone is always a 4 or 4 minus or 4 plus. So I wish there was a way where I could just put a 4 for, let's say, the entire left side, and then a 4 for the entire right side, or a 4 plus for the entire right side.
Okay. Okay, I just wasn't sure you knew how that worked. But if you selected the side, it was gonna, whatever you put it, it's gonna default to the normal, which is 5 out of 5, and then you just document the abnormals by exception.
Right.
Okay.
Okay. So that's that. Okay. Now I'm going to clear all this. Okay. Okay. And we're going to save and close. Okay. So now it's all clear, correct? I'm going to click left. Quick exam, I'll just click whatever, it doesn't matter, knee contusion, okay. Now, let's say I change my mind. 1 second. Okay, so you see that this stuff on the left side is filled out here?
Uh-huh.
Basically, this template is filled out?
Mm-hmm.
Okay, now if I change my mind and I want to cancel it, can I click cancel here?
You can click cancel there, yes, and it will not save it.
Okay, so I'm going to click cancel. Now watch. I'm going to go back to knee. Everything is there.
If you right-click and hit clear, it's going to clear all the fields out.
Yeah, but if I click cancel and not save and close, why is it still saving?
It doesn't save it so that it's going to print. It just saves the values in that field. It's just the way they built the template.
Oh, okay. It was just very confusing because all the information was still there.
Okay, so if you know now that if you right-click and clear, it's going to pull all that out of there.
Okay, so I have to clear it that way. Okay.
Yeah, clear it that way.
Okay. Okay, so that's that. Okay, so by the exercises, if a patient did certain exercises last time, they usually come up next time with the same exercises. I don't know if you're aware of that.
Mm-hmm.
But for the modalities, first of all, I can only put in one body part. So you see, if I click left ankle, and then I put in the time, and I click back, see, it won't let me add a second body part. So let's say the patient had it on the left knee and the right ankle, it won't let me do both.
Okay. Have you tried this? Put that in, then say okay.
Okay.
Now go back to your
Modalities?
Mm-hmm. So you may have moist heat on an ankle and an elbow. Is that what you're saying?
Right. Right. But I can't put in the other one because every time I put one in, the other one gets deleted.
Right. On PT modalities. Okay, I'm going to take control of this just for a second.
No problem.
Okay, got it. I see what you're saying.
Okay.
Thinking there was a way to upload those into the grid, but I guess there's not. That was on an earlier version. Okay, go ahead.
Okay. Now, I'm going to go back first. Okay, so let's say we're going to go to assessment and plan. Okay? Now, the assessment is basically my diagnosis. I don't know if you're aware of that.
Mm-hmm.
The top is what the doctor says they have, but this is my diagnosis of what the actual problem is. Now, this does not copy forward to the note. Is there a way to get it to copy forward to the note? Because it doesn't. So if this is the evaluation, and then next time I write the note, there's nothing in that box.
Now, are you saying the evaluation doesn't copy forward, or the notes don't copy forward?
Certain parts of the evaluation that I would like to copy forward don't copy forward.
Okay, you'd have to be very specific on which of those you want to copy forward, because we can make any of those.
That's what I'm saying. Like, the assessment is very important, and I would like it to copy forward. The objective parts need to copy forward. I mean, honestly, if I could, I would like everything from the evaluation to copy forward, if possible.
Okay, so everything that's on the objective, or everything that's on the assessment plan, or everything on both of them?
Everything on the subjective, objective, and assessment plan.
Okay.
All the tabs, if possible. I know it sounds like a lot, but this way, if the insurance company asks me for their last treatment session note, they have more information than just the exercises that the patient did. They have a full history of it.
Okay. Do all of your none of this copies forward? Is that what you're saying? None of it does?
Only the goals copy forward. That's it.
Okay, I'm making some notes. Okay, a couple things I want to point out. Do you have a patient in here that we're in test, that you have done some of these evaluations on in the past?
I'm sorry, can you repeat that?
Do you have a patient in this test database that you've done some of these evaluations on in the past?
No, they're not in test, and the prod. We can pull
Not
up
even
a
in.
regular patient.
I'm sorry.
If we pull up a regular patient, do you think it's going to show up in the test?
Not unless you've copied test.
I could pull up a patient from today and just do their daily note and show you that nothing from the evaluation comes forward.
This is the test environment. You have to go out to the prod.
What I want to show you is this. Let me look at this right here on this 825 encounter. Well, there's nothing there, so that won't help me. So, so in test, you don't have any patients that when you were learning to use these templates, that you did anything on.
They never trained physical therapy on this template. This is the first time we just went nose diving.
You just jumped right in and started using it, huh?
Once we went live, yeah.
Oh, here we got some.
Okay.
All right, so I've got a couple little things. I've got on this 825 visit, I've got my PT home. What I want to show you is this. Let me close this. Now I could take this template right here. Let me look at this one. I don't want to do a PT home because we've already got a PT home. There's nothing there. Well, this is not helpful. Nope, nothing there. Okay, I got a couple little things there. I can drag and drop templates from one encounter to the other. And to do that, I'm going to grab this template and I'm going to click on it and I'm going to drag it up here to this encounter, and I'm going to drop it, and it's going to say, do you want to have this template in this encounter? And I'm going to say yes.
Which template did you copy?
Okay, I'm just going to pull one of these up. I'm going to say I want this gyn office visit, just as an example. So I'm going to drag it up here, and I'm going to drop it. It's going to say, do you want to copy this template to this encounter?
So it copies the same exact thing in that date?
Yes. So I can drag and drop.
But it's not there now.
Right here it is. Right here it is. Right here it is.
But it's not in the box.
It will be when I save it.
Oh, okay.
When I save it over here, it's there.
Oh, I see. And then this is an exact duplicate of the gyn visit before.
Yes,
meaning the one you just copied.
Let me put something in here and let me show you. So we've got constitutional check, we've got cardiovascular, and we've got breast on this gyn exam proc, okay? And we're on this 825 encounter. So I'm going to grab this template, and I'm going to hold my left mouse key down, and I'm going to drag it up here, and I'm going to drop it. It's going to say, do you want to copy this template? I'm going to say yes. My things are still checked.
Okay.
Now, when I save it, it's going to be in this encounter.
Okay.
Make sense? Make
Yes.
sense? So you can drag and drop those from your prior encounter.
Yeah. Okay, but see, that's the problem. I can drag and drop from the encounter, but the stuff that was originally in the initial evaluation, I'm not going to keep copying forward to every single day.
But I thought that's what you just said. You wanted everything to copy forward.
I want the information to copy forward.
This copied forward. Constitutional's checked, cardiovascular's checked, and breast is checked on this new encounter that I just dropped it into.
No, this is different. This is OBGYN. You can't...
Because there's nothing in the PT template. So let me go back to the PT template and put something in there and show you the same thing. All right, so let's go to...
So wait, why don't we do this? Can I try something?
Sure, go right ahead.
I'm just gonna go up. Okay, so I'm just gonna go up here. So we're on 923, correct?
Uh-huh.
So we did the evaluation, right? I put in all the. So we have all this lumbar information here.
Uh-huh.
Okay. Everything I'm gonna put normal, etc., etc. Okay. Okay, save. And then I'm going to go to assessment. Yes. Patient presents with spinal stenosis. So let's say that's my evaluation of them.
Okay.
And I'm going to save it. Okay. What happened to the common assessment? Okay.
Okay, so you got a lot of assessments. You got your assessment in there.
Okay. So
now you want to close all that? You want to close all?
Yeah, I'm just going to put in one goal to see if it carries forward. Okay. Okay. I'm just going to put in one goal. And then the comments, the plan also does not copy forward. So, patient agrees with plan of care, let's say. Okay, so I'm going to save this. We're going to close it. I'm going to close everything. Okay, now I'm going to make a new folder here.
Okay.
Okay, and now we're going to make a daily note.
Go to all. Go to all.
PT home.
Okay.
Okay, so now I put visit type. So now, so now the patient is back for back pain. Okay, go to note. Okay, now this is another thing before I go to the objective and see if the stuff is there. Is there a way of that I can keep this, you see, the same thing every time? Because if the patient is there every time for the same thing, is there a way to make it just come up instead of putting it in there?
Yep, they could make every field in your database copy data forward if that's what you wanted. Somebody's going to have to go into Template Editor and touch every field, but yes, they can.
Yeah, because for example, in this field, complaint of, this is also like the modalities. So if I click left ankle, I cannot add left knee also. It won't let me add two body parts, and a lot of patients are here for, let's say, shoulder and back. So if I click left ankle, it won't let me click right hip. It's just like that modalities box that we spoke about earlier.
Mm-hmm. Okay.
Okay. And then if we can please have this patient unable to copy forward, it's very important because I have to type this in every time every single patient. So
you think the drag and drop's not going to help you on that, huh?
Well, no, because you see, I can do a note now and then try another note, and it won't come up on the next note. So
if you drag and drop it, it will.
So you're just saying I should just drag and drop everything?
Well, if you want everything, it's either that.
Note, I'm saying, if If it's a note, I should just drag and drop it.
No, the whole template. You could drag and drop.
Oh, I see.
Does that make sense?
Yes. I guess, okay, I could do that.
Now, the other solution is that, and I think you're going to have a little meeting about this, because are you the only therapist?
Yes.
Okay. The other solution is to open every single PT template and make every single field copy data forward. So that then every time you open it, it's going to say the same thing that it said the last time.
Right. Is that a big job? I don't know.
Well, I mean, it's time-consuming. It's not hard, but it's time-consuming.
I guess it's really, I mean, it would help me, but if it's really time-consuming and difficult, then I would just drag and drop.
Yeah, it's not hard. It's not hard to do at all, but somebody's going to have to spend the time, right? And let me show you exactly what it involves. I'm going to open this PT note, okay, in the template editor, so I'll show you exactly what it involves. We want to open PT note, this template right here, the one we were just on in this. Now, we right-click on the field, we go to the properties, we go to the Advanced tab, and we make it copy data forward. And that has to be done on every single field, if that's what you want.
Okay, I think I could do that. It shouldn't take me more than half an hour.
For every template in your database?
Not every template, just like this, and the patient unable to...
Okay, but let me ask you this. Are you the one that has the security to go into Template Editor to do that? Because that normally is something that's locked down pretty tightly.
Yeah, no, I don't have access to anything.
Yeah, see, that's my point. Whoever has responsibility, because that's not everything. I have to copy this template before I can make changes to it. So I have to go up here and say copy template, rename it, update the links, then I have to go to every field that I want to copy data forward and say, right-click, properties, advanced, and say, copy that data forward. Does that make sense?
Yes.
Okay.
But I don't have access to this. Honestly, I would spend...
Who's going to be the one to make decisions about whether you can have access to that or not?
Karen, I guess. Well...
Maybe Val or Miss Karen.
Val, are you still there?
Yes.
Are you listening?
Yes.
And?
Yeah, I think I can work with David together.
Okay. Do you understand what I'm saying?
Yes. It's just because
okay. I hear his frustration. I hear it a lot. Some of the things, that's the first time I've ever heard it, like the special test not being there. That's the first time I've ever heard that. But, PT and OT and behavioral health, they always have kind of the same thing. I want everything forward because when I treat them for a shoulder injury, I treat them time after time after time for it. And I've asked many times for them to please, when they develop these templates, to make all that information copy data forward on those specialties because they are seen repeatedly for the same thing. So far, they haven't given it to us. But you can do it. It's just that it's time-consuming.
Right.
Okay. Well, I mean, even if I could do it for these few things, like patient unable to complain of their pain, etc., that would really help me. Even if it's like 10 things out of the everything.
Okay. Well, you know what he wants.
Yeah, I think I have sit down with him to do together.
Okay. So you know what he wants there. Now, while I'm here, and while I've got you, have you copied any of your templates already to make any changes to them?
Yes, we did, but we didn't make lots of change. Only the.
Okay. What prefix did you use for those templates?
Just use the AFAM. Yes, we use capital AFAM. Just put the capital.
Okay. Did you do it all in test? I mean, in prod?
Yeah, prod. Yeah.
Yeah, because for a test, I don't see any.
Yeah, you're correct. That's
All right.
why we,
Here's what I'm going to show you.
Okay.
NGKBM custom pick list. This one right here. When you look at this template, do you know what you're looking at? Have you seen this template before? Does it look familiar?
Yeah, I saw this before.
Okay. Here's what he wants. I'm going to come down here to this.
Yeah.
Well, I've got to copy this template. Okay, that's the first step.
Yeah.
I'm going to name it DB because just in case.
Yeah.
Okay. Now, make shared, copy, update the template links. I'm going to say yes. It doesn't make any difference on this template.
Okay.
But I'm just going to show you that one pick list that he wants something done to. All right, so I'm going to go to this, and I'm going to go here, and I'm going to add new, and I'm going to say entry click. I want a pick list. And I'm just attaching it here just so that I can get to it to make the changes to it. Am I telling you more than you need to know, or am I telling you? Okay, now I have to find the pick list, and it's that one that just had the numbers on it. All right, so I don't even see it there. What was the name of that template we were on? Let me get my notes here. On all histories. So if we go back to here. Give me a sec to find the template so we can see what the name of the actual template is.
Yeah.
Histories. And where were we?
I think you went objective.
Yeah, you're right, objective. And we went to lumbar. And nope, that wasn't it.
Oh, assessment or something?
Hold on a minute. Let me see. Let me look at my notes here. All histories on PT notes. History detail button.
Try that one.
I'm sorry, which one?
Assessment and plan. Try that template. Is that what you're looking for?
Nope.
Oh.
Hold on a minute. Hold on. It was one of these on here. We went to lumbar. Where else did he go? He went to knee.
Is it still there? No.
Oh, I know where it was. It was on the HPI.
Okay.
It was here.
Yeah.
Yep. Back pain HPI. So let's see what pick list that is. So I'm going to go down here. I'm going to open up another template editor. Just in case you didn't know, you can't have multiples open. Each template can only be open one time.
Yeah.
And that's the display name, back pain HPI, and there it is.
Yeah.
Okay, so I'm going to go right here. I don't even know if the trigger's on here or not, but pick list, number 1 to 10. So I'm going to create a whole new pick list because I don't want to make changes to that pick list.
You need to make a copy first.
Yep. So it's called number. Let me see if there's any of these I can use. Did somebody just hang up?
Oh.
No, we're all
Okay.
here.
Okay. All right. So, about what I'm going to do
Yes.
is I'm going to make a whole new pick list, and then you'll have to copy that template and attach this new pick list.
Yeah.
Because I don't want to make changes to, see, none of these are exactly what he wants.
Right.
So, Yeah, none of these are exactly what he wants. So I'm going to do a new one, and I'm going to call it severity number, whoops. Severity out of 10. Okay? So now he wants 1 out of 10. He wants 2 out of 10. You get the idea here?
Yes.
Then we have to go to that template, and there's probably more than one that he wants this on, and change that pick list trigger to this one, this out of 10. But we're in test. This doesn't exist in prod yet. I just want you to understand what it is that he wants. And then, of course, you'll have to rearrange them so that they're in order.
Yeah.
You okay?
Yes.
Are you going, oh, my God?
That's, we didn't make a copy. That's, we just changed that.
And I'm going to change this label here just to say out of 10 examples. Out of 10 pick list examples. Come on, move over there. Okay, we all right?
Yeah, perfect.
Okay, now that's not done, but it's an example so that it can be done for you. All right. Val, you just got a lot of job security there. You know that, don't you?
Yeah.
You see, Val, I made sure you don't get fired.
Okay, let's jump back over here.
Okay.
I'm trying to give you what you want and keep it as simple as possible, but some of the things you want, there just is no, it's not a complex answer, it's just a very labor-intensive answer.
Yeah.
Okay.
Are you writing, Val, I have to ask you this, are you writing kill dot?
Kill David.
That's more like what he'll be doing.
Yeah, and those two things, making those fields copy data forward and changing those severity pick lists so that it says 1 out of 10 or, all that, is going to give him what he wants. But that one thing that doesn't give him still is the ability to select multiple things in those spots where he wants to.
Yeah, but for now it's not linked to that. Yeah.
Right. And there's a way to do that. It's just that's where we get into the complex things.
Yeah.
Okay, go ahead, David. It's all yours.
Okay. Where was I? Okay, so this is... okay, 1 second. I'm going to close this because we were doing a note, right, for today.
Yep. I'm sorry, I jumped off there, but I wanted to show you that yes, you guys can do this internally, and this is how you can do it. This is how you can achieve that. That doesn't help with the multi-select things, but at least that gives you some of the things you want.
Okay, so for example, now you see if I go to the assessment from the evaluation, it does not copy forward. You see, our goals did. Remember, I told you the goal does, but the comments and the assessment from the evaluation that we just did down here does not copy forward.
Okay. PT note assess plan. We don't even have one of those on this encounter. Give me a sec here. that on this? Were you on the subjective? Is this where you were? PT? Nope. You're on this one. Okay. Patient presents with spinal stenosis. Okay, so that's on that encounter. And when you open it on the next encounter. Okay, that's another case of just this copy data forward field.
Okay.
Yep, all you have to do is make those notes copy data forward, and they're going to pull forward for all eternity. And I'm not making a note of these. You know the ones that you want to copy data forward, so that's what you're going to sit down with Bob with, and you're going to say, okay, I want this one, this one, this one, this one, this one.
Okay.
Okay, next.
Okay, so now it's the treatment, PT treatment, take control. Yeah, okay. So now he's done his assessment, so I think the next thing is the PT treatment, right? Oh, see? You haven't done 50. Okay, let's say for this one, isn't it supposed to pull forward here automatically?
What she means is that in order to bill it, there has to be a diagnosis code here, which we have to copy from here. Is there a way that it can automatically, this diagnosis code can come into here, or I have to click here and click here?
Yeah,
and apart from, I'm sorry. Apart from
that's all right.
If you notice on this page, it says 97001. Mm-hmm. When you go to the treatment codes to submit it to Superbill, isn't it supposed to just automatically come up here to this column? Like, why do we have to put it in?
No, I don't put it in. It brings it up itself.
No, it doesn't. Let me see. It's here. You have to put the piece.
No, so you have to select it.
Yeah, that's
so
what
let's say.
Doesn't it just, if you already billed for it, doesn't it just copy over?
No, but you can make those fields copy data forward if they're going to be the same every time.
No. The eval is just one time, so that one doesn't copy forward. And it depends on what you do. It changes kind of because it depends on...
Right, it changes, so I don't think I'd want this to copy forward, but...
No. It wasn't even a copy forward. Can I take control? Let me just show you what...
Sure, you got it.
Yeah. You see, it's here already. Once you fill your template, it says initial eval. Automatically it bills you what you did. So when you come to submit charges, since it's already, telling you what you did, you can't, change it because that's exactly what you did. Shouldn't it just appear here and then you just submit to Superbill? It should just appear like 97001, which is what you actually did, and it's telling you on the other page that you actually did a 97001.
But you're looking at two different dates.
Okay.
Okay, so
I'm talking of this one day. I'm saying the eval that was done. So now I have to select this and say it's 1 unit because usually just 1 unit. Okay, and then for me to get the diagnosis code, I have to do that. And then and
then if you want to apply the Medicare rules, you're going to apply Medicare.
Yeah, but that's the problem. We have to. We don't even have a choice because if we don't, it won't submit to Superbill, and I'm going to show you right now.
Okay.
Oh, it's submitting in your login. That's why it's submitting.
Okay.
My login or his login, if you did that, it will bring up a red. It'll highlight something red saying that the time and the it doesn't match up the time, the units and the code. And I'll show you an example.
But you didn't put anything here.
I'm coming. I'm going to put something.
Yes.
Therapeutic exercise. Okay, so say we treated a client for, say, 35 minutes. Okay. So automatically populates the unit, right?
That's wrong.
And then, it says 35 minutes and the unit is 3. I'm not going to apply Medicare rules. I'm going to submit to Superbill. See? You're about to bill for more units than indicated by the total time. Please select suppress billing to indicate a no charge. We can't do that because we have to treat it for Yeah, so if, say, I change that unit to 2, which 35 minutes is supposed to be, I think, 2 units, and I submit the super bill, it's still the same thing. So no matter what happens with this, it still says...
Okay, the first thing I want to do...
I'm just trying to change it to 10 minutes so it goes to like 1 unit. That's 1 unit. It's still the same thing. But once I do this and submit the super bill, it will do that. It will submit the charge.
Okay, so basically you want the apply Medicare checkbox to always be checked. Is that what I'm hearing?
No, I don't know what it means. As in, how does it affect? Why does it affect?
You're saying that if that box isn't checked, it will always come up red, right?
Right, it looks like it's always going to come up red. See this little I right here?
Yeah.
CMS, as well as many other payers, require the use of 8-minute rule when billing units for time-based therapy.
Right.
This tells you, what the rule is right here.
Okay. So, but then that means there's something wrong, because if I take control a little bit now,
Sure.
sorry, you're gonna see that I put 35. If you notice
Okay,
that
you're not going to be able to do it again because the charges have already been submitted.
Oh,
See how that red down there says charges submitted?
Yeah.
You're going to have to get on a different encounter
that's
because
true.
those charges have already been submitted and won't let you submit them multiple times.
Okay, and even if I cancel and go back,
No, they're already submitted.
Yeah, sure. Okay.
Go to a different encounter and do the same thing.
Okay. So let me go back to this one that we did and see if you can review this note. Sorry. Okay, sure. Yeah, so I'm good. I created another eval. Oh, this is
Okay.
the thing now.
What are you doing?
Right.
It's okay. I'll just click Medicare box. That's not
Okay.
the way.
No, it doesn't matter, really. You're just going to keep clicking the Medicare box.
Oh,
Okay.
you know what? You know what? We have to copy forward also, please. This treating therapist. I have to write my name in every time. I'm the only therapist.
Doesn't it just pull in the current user?
No,
Let's make sure it's a test, but it's okay.
no. When I log in, it doesn't come up my name.
Yeah, that we can change. That's just user preference. We can change.
Yeah, I guess we just got to do the copy forward thing.
Okay. Are you all ready with that?
Uh-huh.
Okay.
Okay, so I don't know. I don't have any other thing. I don't know. David?
Oh, one last thing. Is there a way? Where is it? Is there a way where we can edit this page?
Okay, when you say edit's a pretty big word. Specifically what?
Edit meaning take away all this top stuff on the left and put in different stuff.
Yeah, there's a way.
Because I don't know if you remember, I told you this last time. A lot of it has to be related to function now. So I have to make. I would like to make some standard goals that are functional. Meaning, for example, a lot of the patients that are coming to outpatient therapy are obviously able to stand up from a chair, or.
I'm sorry. Can you hold on 1 second?
No problem.
sorry, that was my other phone ringing. Okay, so you want totally different things on there, right?
Yeah, mostly because these are all inpatient goals. They're not outpatient.
Yeah, these goals are for patients who are like very debilitated or need a lot of therapy or have a severe problem. But usually when you could come to outpatient, you can do all these things. Otherwise, you wouldn't be able to walk to the clinic. So for example, this goal is for the patient to sit up from a chair. Obviously, if they're walking to therapy, they can sit up from a chair. You know what I mean?
So what kind
of... like goals that are functional. For example, reaching for an object, let's say, above your head if you have shoulder pain is a goal for a patient, right? If you have back pain and you tell me you can't sit more than 30 minutes, my goal for you is to be able to sit more than an hour without back pain.
Okay, so I just want to see what prints. Come on.
I like something.
It doesn't like something a bit.
Yeah, maybe because
What's the deal with that?
Fine.
No, you don't have to.
It certainly doesn't like something. Why will it not even?
Why don't you close up the other template? Maybe. Oh.
This is the patient's work note. I'm just trying to see if it'll generate anything.
Yeah.
So let's close it and reopen it. Close. We had a lot of stuff open behind there.
Okay.
PT evaluate is this. What's up with that?
You done with telling her what to do right now? What's next?
I want to see what kind of triggers are on that preview button. What kind of triggers there are. Something it doesn't like. Oh, visit type. It's not going because it doesn't know the visit type. That's what it wants.
Oh. That means that's from the PT home.
Yep. Whoops. Well, it says evaluation. What's PT treatment? Shut up. Get out of there. We were on PT note, right?
Yeah.
And then assessment. It didn't like that visit type.
Oh, maybe because one had been done before. Same day.
Now you
okay.
see, just one thing. Yeah, I'm sorry. Go ahead.
That's all right. Go ahead.
Do you see this evaluation? it's very, very choppy. They're like, you know what I mean?
You mean the spaces in between there?
Yeah. Well, I mean, just like, get the information.
You mean this big white space right here?
I guess I can't show it on this because not all the information is here because the evaluation wasn't filled out.
Right, because we didn't do a complete thing. We didn't start at the beginning and complete it.
Oh, can I check something for a second?
Sure.
If I remember, we did objective over here.
No, not on this one, I guess.
Oh, yeah.
Remember, we're going back and forth between encounters, so.
Yeah. You see this lumbar spine, this objective stuff? Right? Yeah, it was saved and closed. But it's not in the document.
Okay, hold on. Let's close
Maybe
this.
you have to redo this again.
Yep, hold on. Let me close this. It's not going to let you run it because it's already open back here. We got multiple things open. Okay. So now let's do preview. We're going to overwrite it. Come on. Now, you want to scroll down there and see? Still not there.
Lumbar is there.
It's there.
Yeah, it wasn't saved and closed before. It was
Yeah, I think we canceled out of there. And
yeah, it wasn't saved and closed. It's all there.
is that what you're talking about, choppy, where there's big white spaces in between? David?
No, choppy meaning it's just like blocks of information. There's no sentences or anything like that. There are no constructions. There's just
Okay.
back pain. Severity level is 2. You see, it's just meaning. For example, if I were to send you this and you were another doctor, would you be able to figure out what is exactly wrong with the patient? I think not, or very difficult to figure out.
Okay, here's what I want to do. I want to jump over to Prod, and I want you to show me one of your complete notes so that we can talk about it, because this we didn't do a complete note on. So let's go over to Prod, log out of here, and I'm gonna close the template editor and everything so we don't get all messed up here. Yes. Now we're going to change our database. Okay, now I want you to log in there because I want to see if maybe some of your permissions aren't correct.
Okay.
And then find us a patient and show me the note on it.
No problem. Okay. I just frozen. Oh, you're controlling?
Nope. All you do is click it. I must have breathed on it. I didn't mean to touch it.
No problem. So this patient, here we go. I did the evaluation here. Just going to pull up the evaluation.
Okay.
Okay. Now, you see, this is what I was talking about before. You showed me how to take it away.
Okay. So we know how to do that.
So you see how much information is here that really shouldn't be? Like.
Yep. And all you have to do is take that little black dot away.
Right. So this comment over here, the subjective, you see this?
Uh-huh.
This is me typing in free text in over here. Evaluate. on the bottom over here. Okay? So, for example, because I feel like if you're reading the HPI over here and you don't know anything about the patient, you would not know what's going on. But if you read my subjective, I would just give it, by reading these two lines, give you a clear picture of what the patient is there for and what's wrong. Can you see that?
Mm-hmm.
Would you like to just read it and see what I'm talking about?
Right, I see what you're saying. The verbiage is just different.
Right. So now, if I were to send this to the insurance company, is there a way where we can bring this higher, maybe over here in the beginning, so that it could be before the HPI, so that you can read, so that you can read, patient is a 51-year-old female who reports low back pain since July. Patient saw the doctor and was referred to PT, now reports 6 out of 10 low back pain, which increases with standing, sitting, and sleeping. And then it would say the severity is moderate to severe, the problem is worsening, it occurs intermittently. I think it would make more sense as opposed to being this, and then this stuff is here, which is going to get rid of anyways, and then employment history, and then the comment is here.
Okay,
it's just not in order, basically.
Okay, here's the first thing. There's different documents. We are on the PT initial eval. Mm-hmm. So what we would have to do is, and it's right under, make a note where it is. Employment history. So let's open this document in the document builder, and I'll show you what it takes to change that. Oh, you don't have access. Let's log out and log back in as me and see if I've got access to it. Come on. First thing we have to do is find out exactly where it's coming from. So, all of these are sub-documents. So let's look at this again. And it's right under medications, histories, employment.
Sorry, I just think that if that even does 2 lines on top of it, it just makes so much more sense because it's more in order.
Oh, I understand.
As opposed to everything being randomly out of order and gibberish.
Chief complaints, subjective, chronic conditions, recommended care, allergies, history, social. Every one of these little gray things is what we call a macro.
Okay.
And each one of these macros represents a subdocument. So we have to find the subdocument that it's pulling from. Then we have to find the macro that's pulling that information and move the macro. Treatment,
Okay.
assessment, treatment, employment history, comments, assessment. Okay, it's got to be above here. We want the comments subjective. Physical exam. To the employment history. Functional limitations, family history, advanced directives. Histories, which one's this one? History, that's not it. Bob, do you have any idea what we're looking at? Is he still there?
Yes, I think it's down there. Looks like what's the comment.
Hi, I'm here. I'm sorry.
No, I was talking to Bob.
Oh,
Yes.
oh, Val? Oh, okay.
I think it's down there. There is something like a comment. You know.
Yeah, I'm just trying to find which one it is because you see there's a million of them on here.
Yeah. So I guess it's just for you to pull up that thing and push it a little earlier in the template so that...
Right, that's all you have to do is find the one that it actually is
Just
Yeah.
and just
I guess
take it off and then move it
put
up. Does that make sense?
Move it up. Yeah, that's what it needs to do because apparently it prints out with
yeah, go back,
yeah.
take a look again, see what's...
kind of
Right,
prints
and
out
just
in sequence. Yeah.
And it prints off in sequence however you've told it to print. And keep in mind that comments field that he's talking about is not on the main document. It's on one of those sub-documents.
Right.
Yeah.
Okay?
Yes. Okay.
So you just need to move up to where you have before
Right, exactly.
reason for visit. So that
I also
Right.
cheat the logo up there. You know, it's still next gen.
yeah. So it needs to be
is your header fixed?
I did for the primary care, but this one, yeah, the PT I didn't know, so I didn't do that.
But hold on, let me see. Do you know where your logo is? Is it in the doc images folder?
Yeah, this I know where it is.
Can I delete this and we'll put it on here right now?
Yes.
Okay.
Go to,
If I go to image,
yes. I think it's that. Let me see. It's I need to put hold on.
I'll let you.
I don't have control. Hold on.
You know what? If you right click and ask for control, you can get it.
Okay, right click, ask for control.
She's going to have to grant it to you, David, or somebody's going to have to grant it to you, but they can give it to you.
I'm sorry, say that again?
He's going to send across the request for control because we're going to put the logo on here.
okay. So I'm gonna. Oh, it disappeared. I was gonna approve it just
Do
now.
it one more time real fast because it only stays up there a second.
I
Oh.
ask you.
Okay, I did that. But you have control.
Yeah, okay. Let me see. Okay. I just put. What's here? Does it allow me to type anything?
You having trouble?
Let me try to type.
You know what? It might have to do with the. They don't have enough permissions on the network. Go to your network. Go to network.
Yeah, that's. Let me see.
Go to network.
Because sometimes usually I can just type there. Don't see that.
They might not have enough. The way they're logged onto the network, they might not have enough. Whoever's logged in here might not have enough network permissions.
Yeah, because, I mean, I've logged in as physical, except you want to log out of all of this and go back as...
Let me take a look here.
Yeah.
Where's you are? Okay, here, you should have the control. Let me cancel this. Okay. So, you have access RNG root. Yes, next gen root. I think I have that.
Prod. EMR.
EMR, yes.
Documents. Nope. Doc images. Right there. Whoa. Documents. Not the images folder, the documents folder.
Yeah, that's document.
Okay.
Document.
Then doc images.
Yes, doc images. It's there. It's awesome. I think this one. I have this one. 50. I think this one is used.
But
yeah, but usually, like, you can click there and just copy that. See? Yeah, here, I don't know why it's done. This doesn't allow. Sometimes I can just type the. Let me do this. Let me map this folder to a drive. Let's see.
okay.
Back. Just temporarily map it. Just temporarily. Okay. Now we go to.
Did you get that?
Yeah.
Guys, he's not giving you permanent, he's just giving you a temporary.
This one's good. Some prod. Go to P. Yes. EMR.
EMR. Documents. Doc images.
Image.
Now, find it.
Okay, let's see.
That was it. There we go. Okay, I'm going to take control back now.
Okay, yeah.
Or I'm going to try to. I may have to request it again. Yep. Ask to control. Need a response. Very good. All right, now, remember, in document building, you always need to compile. It'll prompt you to save, but if you save, it won't prompt you to compile, and it won't work if you don't compile it.
Yes.
Okay, so now, David still there?
Yes.
Okay. I noticed you didn't run your note for this 923 encounter. Are you ready to run your note for this one?
No, that's today.
You're not ready to run your note?
No, I didn't do the note. I just opened it because I was showing you before about the patient, you remember? See, another thing is the problem. Like, this is supposed to be a note. Just because I clicked on the eval to show you, now it's all the evaluation stuff is here. Even if it's empty, is there a way to get rid of it?
Right. No, because once you click on something, it's saved to that patient's encounter. You're in a legal medical record. That's done for that reason.
Yeah,
even if there's nothing in it. Even if it's empty, it's still going to be there. If you click on it, it's still going to be there.
Okay.
There's not going to be anything in it, and it's not going to print, but it's still going to be there.
Okay.
So are you ready to do that note here so that we can see the logo?
Like you do your notes and then...
Or maybe on the 16th?
Pull up the notes.
You want to rerun this note on the 16th?
No problem. You can rerun it. Go ahead.
I can run this one?
Yeah,
that's fine.
And override.
Okay. Oops. WebEx is getting a little weird with me here.
Okay. I'm sorry. Were we logged in under me? Because now...
I'm sorry, what did you say?
Are you running this logged under me? Cause it's
No,
be...
under her.
Oh, it's under you.
You're going to
okay.
have to preview the notes.
I'm going to have to, okay.
Yeah.
Because you see now it says the treating therapist is next-gen administrator.
Okay, we'll rerun it. I just...
Fine. Yeah, that should be fine. I think that's not serious. And that's just a document generated by, that's not, your name is still there.
That's all we wanted. If I'm not...
Is this a real patient?
Yes, this is a real patient.
Okay, we're going to log out and log back in, and you're going to generate the note. Okay, you log in and generate the note. And Bob, it does say at the top that I'm the treating therapist, so I want him to regenerate the note.
Yes, that's fine.
Just close this one up.
Okay.
Oh, this is from today.
No, she did.
Oh.
No, I did it on the 16th.
No, that's not the one you need to preview.
It's the same one. 16.
Woo!
Yeah.
There we go.
Oh, so we just want that logo? We don't want it to say AFAM Comprehensive?
No, they just...
Yeah, is it possible to change that field from the user name to the render physician? Then we don't have issue for this treaty therapist.
Yeah, you could.
You see.
Well, that's because we want to use the offline document, the utility. Then
No, if you're using, are you using the offline document processor?
not yes, but we want.
What?
But
We're using
even if
offline
you're,
already, Val?
We're not using offline.
No, we're not using it, but that's because sometimes the provider they forget to generate notes.
Okay, so if we open this PT progress note, that's what this one is.
Yeah.
Oh, I got to log out and log back in. Oh, I'm sorry. What were you going to say?
I was just going to show you one thing. Okay, it's fine. Don't worry about it. All right.
PT prog note.
Yeah.
And if you need to change it on the others, it'll be the same thing.
Yeah. Yeah, that's current user. I think that's better user readily provider.
So you want current provider?
Yes. And that way we'll have the issue for that.
Okay, so I'm going to right-click. I'm going to go to macro. I'm going to go to hard-coded. And I'm going to slap in current provider.
Yeah, current provider.
Okay. So now I go to tools. And I go to compile.
Yeah.
Prompts me to save it.
Yeah.
Okay, so that's changed. All right, I want to get out of this real patient. I'm not comfortable being on a real patient. Okay. So we changed a couple things. We know what we have to do to make all those fields copy data forward. You have to attach that 1 out of 10, number out of 10 pick list.
Yeah.
What else we got? You know how not to make the histories print on there?
Right, the copy forward fields.
Yep.
And then, remember we said some of the boxes I can't put in 2 body parts? How do I do that?
Okay. That's again in Template Editor. It takes this. You have to put a hidden field on there, and we have to do what we call concatenation. So you pick the first thing, it assigns it to the hidden field, and it assigns it to the field that's showing. Then you pick the second thing, and it takes what's in the field that's showing, and it puts what you select the second time in the hidden field, and plus what's in the first field. Have you been to a template editing class, Bob?
No, not yet. Yeah, I need that.
How many fields do you think you have that you want concatenation done on?
Are you asking me?
Yeah, where you pick multiple things.
1, maybe 2 or 3. The modalities page, and then on the first page and the home page.
Well, now, the home page, show me the templates that you want this done on. Modalities.
Template. This is a real patient, right?
This is a test patient.
Okay.
Are we in the test? Or?
We're in prod, but we're on a test patient.
Okay, so create a new encounter?
I did. There's a new encounter. There's an encounter already over there.
Oh.
Okay. Are we signed in on the Dr. Dorfman? Okay.
No, you want to click demographic.
Yeah, what Dot showed you, actually, you can't go to demographics, go to adult summary, you know that.
We're logged in on the Dr. Dorfman, so physical therapy doesn't come up.
It comes up in all.
No, it comes up in all. If you go to PT, you're going to see it.
Yeah.
Oh.
There you go. And,
Okay,
the person at the top of the screen is not who's logged in. That's just the provider that was selected.
Mm-hmm.
Yeah, nothing can change that.
Can change your name.
Okay, so treatment, I gotta add a diagnosis. So, okay, so now this person has knee pain and shoulder pain. So now if I go to their note, patient complains of, I can't put in knee pain and shoulder pain together.
Okay, so that's on the PT note.
Mm-hmm.
Okay.
Okay, and then another place is when you're doing.
Here's my question about that. Go back to that. If we give you concatenation, what if the right knee is pain and the left knee is numbness?
Maybe there should be 2 boxes then. Can we make?
Well, that's what we're discussing right here.
Honestly, it's fine because I could click both pain. I could click both pain and numbness. It's fine.
Okay, that's what I need. That's what we need to discuss.
I'm not so specific.
Okay.
I should be, but I'm not, unfortunately.
Okay. Now, let me. Okay. I'm just evaluating the situation here. Then we want concatenation. How many do you want to pick?
How many? 2, 3, 3 at least, 4.
3.
At least, three should be enough.
Okay. 3 complaints. Okay, next.
Okay. And then under modalities, it's the same problem. So when you click moist heat, left wrist, you can put in right knee as well.
What if the times are different?
No, heat is the same time.
Okay. And you need it for moist heat and cold heat and ultrasound and...
No, just the cold and the hot, please.
Moist and cold. Moist heat and cold.
Okay. Okay.
Okay. Okay. And then, so by the, this is a test patient, okay. By the evaluation...
Now, hold on a minute. Go back to the modalities for a second for me. Okay. I'm going to take control here for just a second. All right, we're good. That's all I needed. I just needed to see exactly where we were. Go ahead. I'm sorry.
Okay. And then by the evaluation, I don't know if you remember, but let's say if we pick knee, I can pick both right and left.
Exam, PE, right and left. Okay, I think that's going to be the case in hips. See, it's the case on all of those. So you want to be able to pick right and left on all of those? Shoulders?
I'm sorry?
You want to be able to pick right and left on all of the physical exams?
Yes, please.
So if he chooses not to, then at least you'll be at least the option to be able to pick both body parts at the same time.
So all those physical exams have got to be changed. Okay. All right. Next, we got modalities. The complaints of, you want at least 3 complaints. All of the exams, every single one, right and left. The only ones we won't need to do are the hands because they are specific to right hand and left hand. So we need wrist, shoulder, elbow, hip, knee, foot, and ankle.
Yeah.
Right.
Okay.
And then the special test I was going to put in for the lumbar.
Okay. I don't think I'm going to have time to do that. But let me put it down anyway. Special test for lumbar. And did you get those special tests together, or do you have to get those together?
I can get it together in a few minutes if you want to do it now. I'm not sure, or if Val's going to do it. I really don't know. If you can give me 2 minutes, I can get it together.
Okay. Val?
Yes.
I'm going to need more than just his word that you want me to modify all these templates.
Yes.
Huh? You didn't say it very loud.
Yes, please.
Yeah, we know. I have no power here.
You know what? Responsibility comes with power, and I just assume not have lots. Just kidding. Do you want me to do it right in prod, or do you want to do it in test them and then move them over? You tell me. It's your database.
I think you can do your production part.
We can do it in prod?
Yes.
All right.
Trust you.
You want to put that in writing and send it to me, okay? Can you tell I've been burnt by this before?
Yes, we did that. When we go live, the trainer was here. We just did everything.
Now, yeah, I know. That's what I can tell that. You have not modified any of these templates, right?
No, PT, no. We just only the family,
all right.
That family.
Okay. So here's my hip pain. I'm going to fix this. Just want to see what it is. Yep, that's what it is. I'm going to copy this template. Let me make myself a note. PE hip. I've been with NextGen 13 years, and I've been burnt enough times by enough things that I know what questions to ask. Now, what exactly is your prefix?
AFAM.
AFAM.
Yes.
Okay.
I'm sorry. Are you going to fix the special test now? Should I go get the list together?
I don't know if I'm going to have time to get to that one, but I'm doing the right and left right now.
Okay, no problem.
Choo-choo. Should do the hip.
Yeah, maybe need to log out and then log in. Okay.
Yeah, I closed the template. I'm going to see if that works, but I'm probably going to have to log out. Yep, I'm going to have to log out. All right, we can do that. I just want to test it before I go any further. Like I said, I've been doing this a long time, been burned by a lot of things. Nope. There you go. So the hip's done. Now we need to do knee.
Okay, I'm here for it now. David just went back to, do an eval. Patient's been waiting for a little bit, so...
Yeah, we need to worry about taking care of our patients here. Whoops, gotta copy it first. The hip's done. Right, left, hip's done.
Okay, great.
Yeah.
I'm doing the knee right now.
Thank you.
You're welcome. He should write a database.
Sorry.
I'm sorry. Okay, so let's fix this one.
So hip, knee, and which one is done?
The hip's done. I'm doing the knee right now.
Okay. Copy first.
Yep, you got to copy it first. You can't make any changes to the core ones.
Yeah.
And that's done for a reason.
Yeah.
Yep. Otherwise, you wouldn't be able to upgrade your templates.
Right.
And we don't want to get in that mess.
Nope.
Shoulder, I'm doing right now.
All right.
Shoulder.
What are the triggers doing? Okay. Okay, hip, knee, shoulder.
Yes,
Elbow and wrist.
right. You done foot and ankle too?
Nope, haven't done foot and ankle.
Okay.
I've done hip, knee, shoulder.
Right.
Now we're going to do elbow. Come on.
I.
Elbow's done. Now we're going to do wrist. Couldn't give him everything he wanted, but I can give him some things.
Yeah, well.
Unless we rewrite the whole database.
At least it's something.
Yeah, that's right. I call these the gimmies. You know, I understand. I hear his frustration, but, you know, can it be done? Yeah, but it takes time.
Yeah.
Triggers. Okay, wrist is done.
Right.
Foot and ankle, and then all of these left and rights are done.
Yeah. Foot and ankle.
Guys, it's awfully quiet there to be in Brooklyn.
Well, inside the office is way different. It's raining outside. When you're in this office, you never know. It's when patients come in the rain, that's when you know that it's raining.
You know, because I lived kind of, a truly suburban or country rural life all my life, I have a hard time when I come up east and it's so congested. And, you can't just jump in your car and go anywhere. I mean, in Philadelphia, I was amazed. I've been there several times, but I've never really driven a lot there. This time I had to drive a lot there. People just park anywhere.
And the cars. When the cars are in the road, they just stop in the middle.
They just stop. They just like, okay, I'm parking here. Excuse me, that's a turn lane.
Oh, they must have driven you crazy.
They did. I was pretty. I was pretty excited to get to the airport. All right. So now what are we going to do? We've got about a half an hour left. What can I get done in a half an hour?
Yeah. Can I ask you that? The
Sure.
right page, the list, what's that? That's all the objects used in this template? Like image 001, 45, the button.
No, that's not what you get done in 30 minutes. No.
What?
Can I make a suggestion of what should be done in 30 minutes?
Sure.
Okay. You don't know the right and left, right?
So you can leave the...
Can this one be... should I say changes? No.
That doesn't make any difference. We're a test patient. You can do whatever you want. You want a test patient.
Oh, okay. Okay. So this complaint, this right shoulder thing, he wanted to be able to put, the
multiples?
Yeah, so
multiples?
Right shoulder, he can put in left knee or right knee or whatever, So maybe, 3 boxes of this one can help, because then he can put...
Okay. I'll do that one.
Aligned. Yeah.
Okay, so let me open up the PT note.
Right.
And copy that baby. All right, I'm going to go through how to do this.
Okay.
I have to create a new field. So I'm going to drag me down a field.
Okay.
Okay, and I'm going to call this concat hold.
Concat hold.
And I'm
that's for Boston, right? Not me.
Yeah, that's in Boston. Now, I'm going to come back and hide it. I just want to make sure it's working before I hide it.
Right.
So, on this field, I'm going to put a trigger that's going to say, upon list pick, click. Oh, don't tell me they took that away. Oh, crap, I can't even do this.
Wow.
Upon list pick, upon click, no, I want... Oh, man. Hold on.
Sure. She's done all your rights and lefts.
I've done all your rights and lefts there, David.
Yeah. She's done all your right and left, so I'm trying to see if she can do the...
I'm trying to figure it out. Looks like they took a trigger away from us.
Right.
Oh, man.
Oh, man.
I hate it when they do that.
I know. Tell them to put it back. Oh, my gosh.
Maybe they put it under here. Oh, I know what it is. It's up here. List pick. and just moved it around a little bit. Upon list pick, come on, I want to assign a field value.
Okay.
And I'm going to add, and the value I want to, let me see the name of this field. PT, let me make a note here. PT note TXT OLOC. So I want to assign what's in this field. PT note, note text COLOC to my brand new field that I just put on here. AMFAM. Whoops. No. Get up here. There it is.
EFA. Yeah. On cold. And
now, let me think about this a minute. So I'm taking this value and I'm putting it in that field.
okay.
So then I want to add another upon list pick. I want to assign what's in this field plus what's in this field. I haven't done one of these in a while. I'm kind of excited about getting to do one.
Sure.
Back to this field.
Right. Okay. And then add.
Now let me see. Can't add same template field more than once. Oh, I'm going to have to create another field.
Okay.
Hold on, let me think about this. So if I put this plus what's in there back to this field. La, la, la. You know, sometimes when you get away from it, you know, it's like that old saying, if you don't lose it, if you don't use it, you lose it. So I've done this for a while.
Yeah.
So I want the total sum of this in this field.
Okay.
Okay, let's see if it's going to work here. We might have to split those triggers out, but we'll see. This is kind of exciting to get to do this. I haven't done this in a while.
Right.
I've been doing so many go-lives and stuff. All right. So let me go here. Let me go to all. AMFAM PT note. Now, left ankle. Oh, I forgot to put my & sign in there. Well, crapanola. Oh, but this is going to work fine. I just forgot to put my & sign in there.
Yeah.
Triggers. Plus.
Put a space or comma, whatever.
Plus, comma.
Yeah.
Plus
Doesn't
space.
Yeah.
Plus that. Okay.
Okay. Oh.
See, that's why I always test.
Yeah.
Can never test too much. All right, so let me close it and reopen it. Yeah. PT note. Right click. Oh, that's the wrong one. That one obviously is not going to work.
Why?
Because it's not the right template. The right template is this one.
Yeah. Oh, so now we're not going to be using the PT note regular. We're going to be using
Right. Now, yeah. All right, so I come to here, say complains of left hip.
Why are you doubling it?
Hold on. Let me think about this a minute.
Yeah.
So I need the first part of that not in there.
So it's doubling everything.
Okay, it's doubling it. I know. I just got to figure out why it's doubling it.
Yeah?
I know. Like I said, I haven't done it in a while. I just have to remember what the heck I'm doing. So it's this one. So if I assign, either one of you programmers?
Maybe if you take out the first one, I'm just saying.
So this needs to come back here. Let me think about the whole process here. So I'm assigning this to this. Then when I pick the second one, I want what do I want? I want this plus what's in. Now it's still going to double it. What do I want here? What do I want? I want what's in the concat field.
Yeah.
But that's still in the concat field. So, oh man, let me think about this a minute.
Sure.
Logic. Use your logical head. I need another field. I need another field. That's going to be the easiest way to do it. Pull down another field.
Oh.
And I'm going to make this concat 2 field.
Two.
Now, what triggers are going to be list pick. I want to assign a field value. This is the one that's causing me the problem. So I want to get rid of this one. And what do I want to do here? So now I'm getting that in the concatenation hold field. This into that.
Okay.
Now my next one is going to be if this field is txt.
You passed it somewhere up there.
Yep, there it is.
TT, yeah.
Equals, not equal to blank. Okay, so now update. Now I want another one that says, upon list pick, I want to assign a field value, and the value is going to be what's in this field plus comma plus space plus what's in this field to this field. PT text. Look. So take this, and do this, do this, do this. If do this one, if the field, if this field,
Just went past it.
I'm sorry?
You just went past it.
Yes, I sure did. This text. Where is it? Text
Up on the list.
Oh, there it is. Is not equal to null. And this other one needs to be is equal to null. This needs to be is equal to null. All right, let's see how this works.
Okay. Oh, this sounds like Greek.
It all is Greek. It's all Greek. Every bit of it.
It is.
Especially when you haven't done it for a long time.
Yeah.
I used to do these things in my sleep, but I haven't been doing template editing for a long time. So let's clear this. All right, get out of there. Complaints of left ankle, left ankle, left ankle, we're good. And right wrist. I didn't get the first value. I didn't get the first value. Now I just get the comma and the space. So something else is wrong with it.
Right.
I'm going to put you on hold because I've got to go to the restroom really fast, okay?
Sure, no problem.
Okay, I'll be right back.
Right, no problem. I'm here.
Okay, I'm back. Is Boss still here?
Okay, yeah.
You still here? You haven't left me? Okay, here's what I want to do. I want to export this template, and I want you to email it to me. Okay? Because I don't want to waste your time while I figure out. I've got one little field that needs to be moved in that trigger.
Okay.
And I don't want to waste your time while I'm trying to figure it out. So I'll get it figured out. It probably won't be till tonight, late. And then I'll email it back to you and we'll re-import it.
Okay, thank you.
Does that sound like a plan?
Yes.
I just don't want to. And tell David if he looks at this template not to freak out because it looks so funky. Let me see where we're exporting it to. Do you have access to all that so you can email this to me? That's where it's going.
Yes, no problem.
Okay. All right. So I want to find AM, search, PT note, export. This is actually kind of fun because I haven't.
Right, go to...
No, it's just a log file. I'm not worried about that.
Are you back? I'm sorry, I went to take a, use the bathroom myself.
Yeah. Okay. Well, I'm. Bob's going to email me this template. I'm not going to waste any more of your time trying to figure out. I've got one little field that's out of place, and so I'm going to figure it out, and I'll email it back to him, and then we'll get it imported. And tell David not to panic if he looks at this template and it looks all funky.
Okay, so let me get it straight. We're supposed to use the AFAM PT note, not the PT note anymore?
Well, the AFAN PT notes looks funky.
Okay, so we should stick to the PT
Yeah,
note.
just stick to the PT note until I send it back to you. It'll be either late tonight or sometime over the weekend, and then I'll get with you sometime Monday and we'll get it imported, okay?
Okay.
That sound like a plan?
We should just use, we just use what we used in before until everything's
just use exactly what you were using before. Now, he also wants, if I get time, I'm also going to do the modalities. I might not get time, but I'll try to get time to do the modalities too.
Okay. All right. Thank you.
You're very welcome. Thank you, guys.
You've been a lot of help. Thank you so much.
Okay.
Maybe can you quickly show me how to link this to the, once you're done, I think this we need to link to the AFAM notes, right? Or it's already linked here, the last
I've already updated the link.
Okay, I see.
Yeah.
Okay, that's fine.
So now what I want you to do, or maybe I can do it from here.
Right now.
Yeah, we need to, I'll let you drive. Just, we need to be able to grab that template.
Okay.
And email it to me.
Yes.
So my work here is done?
Your work here is done, dear. You're done.
Thank you. I'm just going to...
You're very welcome.
Yeah.
Okay.
Yeah, I can go to the image. I think I can. Let me see. Product EMR.
No. Are you trying to get to the template?
Yes.
You know what?
Try to get from my computer.
No, you're not going to be able to do it from there. You're going to have to do it from this one.
Oh.
Can you get to an email from here? If you can't, I can.
Yeah, I can. Yes.
Okay.
Let me go to my email. Here. Oh no, not this one. Sorry, because that's remote. So here, yes. So be here. Let's go. Don't have the control. Let me. Yeah, I need to log into that computer then. Okay. Let me get the control first. Okay. I'm okay now. Let me go there. Email. So you want me just log into my email then?
Yep, log into your email.
Okay, so let me go to new email.
Okay, hold on a minute.
I have your email just right?
That's me.
Yeah.
But here, I'm gonna ask you to change it.
Okay. Yeah.
I want you to change it to.
Yeah.
You know what? I'm going to change it for you.
Okay.
Because sometimes that work email, it has a block on it.
Right.
You know.
Okay. Yeah.
Okay. Now see if you can attach that template.
Okay. That's on PT notes. Let me attach that. Forgot where it is.
It's in the database path in the template/export folder.
Yeah. I think it's this EHR. That will be prod.
Prod. Remember, you said do everything in prod.
Yeah, prod. And then EMR.
EMR. Templates.
Templates.
Export. There it is. You already passed it. It's at the top. Third one down.
This one. Not this one. It's this. Yeah.
That's it. That's all I need. It's thinking about it a long time.
Mm-hmm. So you don't want to export the evaluate template too?
Oh, my God. Okay.
The evaluate?
Yeah.
Why do I need the evaluate?
I don't know. I thought there was something on it that we're supposed to also change. There was one thing on it. I don't think we worked on it yet. I'm not sure, but I think.
I didn't do anything on the evaluate template. I just did the PEs, right and left.
Yeah.
And I worked on the PT note.
Yeah.
And I'm going to try to do the modalities. I don't know if I'll have time, but I'm going to try.
Yeah. Oh, okay.
But at least if I get this PT note done, Bob will have a reference so he'll know how to do the modalities.
All right.
Does that sound like a plan?
That sounds like a plan. Wow, does it sound like a plan?
Yeah, you know, that training we didn't get because that we have to go to your training center for the template training. So.
All right, I'm going to hit send here because it's attached.
Yeah.
Now, let me make sure that I get it.
Yeah, let me see. Send. Yeah. Send. Okay.
Yeah, I sent it, so let me make sure I get it here. And then I'll be able to let you go because I don't see any need to. Oh, I got it. I'm good.
Okay.
All right, like I said, I'm going to get off here and not take up any more of your time. And I've got calls all afternoon, so if I get to it, it won't be till late tonight or sometime over the weekend. And I'll get it to you by Monday morning, and we'll get it loaded Monday.
Okay, thank you.
I am going to be traveling on Monday, so I'll be in a plane part of the day. But, we'll hook up sometime Monday to get it done.
Okay.
All right?
No problem. Thank you. That appreciate it.
Thank you very much. And you have my email if you have any questions.
Yeah. Thank you.
Okay.
Yeah.
Thank you, guys.
Thank you. Have a good day.
Okay. Bye-bye.
Bye-bye. Bye-bye.
Thanks for using WebEx. Please visit our website at www.webex.com.